how did you get into jiu-jitsu? Because I know you were a PT first and then you got into jiu-jitsu. Is that right?
Kind of. I started with going to school really initially, and then I'd always enjoyed watching, UFC and all that. And
Yeah.
so I don't know. I got the itch to go try it. I don't know why. A guy that was actually, I think I was working at the YMCA, and a guy that I was kind of working with, he had wrestled. I never wrestled. And he's like, "Yeah, I coach wrestling at this jiu-jitsu place." I was like, "Okay, so I'll go." And I didn't even really think I was going to go. But then I called him that day that he told me class was, and he didn't pick up the phone. So I just went, and it was like me and the instructor, literally, and
Oh,
that was it. And he was just like showing me that, like, here's mount, here's half guard, here's all this stuff. And I was like, this is so, I mean, I was like, I had the smile on my face because I was like, I seen all this stuff on TV. And this was like, for what I've seen was like Hoist Gracie and that kind of stuff.
yeah.
So I was like, this is awesome. So I just started showing up. My buddy Adam, who's a black belt as well.
Yeah, yeah, yeah.
We went to middle school together, went to high school together. He's one of those guys that I could be like, let's do this thing. And he'd be like, I'm down. Let's do it. So he started a couple weeks after I did. And then we just kind of started going. It was in 2008. And so I was in PT school. I was in the middle of PT school. So it was kind of interesting,
Wow.
just seeing those two, just like going to school, learning about the body, and then learning about the body in a different way. It was interesting. I never really had any visions of combining the two, or any kind of, I was just doing one and doing the other. And I figured, I liked training, and I think it was just something, I was always into athletics and stuff. So it was just kind of something I was willing to try, and very out of my comfort zone. So I was like, yeah, so I just did it.
Yeah. I think that's the thing, like, out of the comfort zone is kind of like the key thing, on that. And
Yeah.
one really important thing, or thing, or goal that I have is to have more healthcare professionals in the field. And it's for some people who may not know, it's so interesting what you were just saying because you were in PT school.
Mhm.
So for people who don't know, I don't know if it was that way at your time, but when you're in PT school, you can't stop. Like once you start, you have to finish all the way
Sure.
through. You
Yeah.
may have like, a year of absence, but you kind of you don't get any
Right.
credit. So you have to start all over if you're in the middle of the year or whatever.
Mhm.
So, and I think one goal to get healthcare professionals more into the sport is to destigmatize like the danger and risk of it a little bit, to reasonable amounts. And that's what I want to like hear you like maybe elaborate a little bit more, like your fear of injury, because if you're in PT school, you get injured, that's a big deal. And even now as a PT,
Mhm.
or other healthcare professionals like nurses, surgeons, MDs, whoever, I mean, that's always like the main concern. I don't want to get injured. I don't want to train because of that.
Mhm.
So how did you like deal with that, or how did
Um,
you manage through those
Man, it was a
waters?
constant battle because I actually did get injured. I fractured my thumb. I
That's not very
fractured
good to promote.
I fractured my thumb. Oh, I
Oh,
did, but I
wow.
was able to like work around it. Actually, is I had just finished a rotation, and like I was just doing some training, got my finger caught and fractured it. And
So you got your finger caught in like
like
the
in
gi?
behind somebody's back. I was
Oh,
a white belt, so I was
okay.
like, I had my hand somehow got caught, and I popped it, and I was like, when you hurt yourself pretty bad,
Yeah.
because I've had a couple injuries, well, not a couple, probably quite a few, but when you hurt something, like if you fracture something, you feel
Yeah.
like you're about to throw up.
Yeah.
So
That's bad.
I was like, oh my god, and so I got an X-ray, and I was put in a splint, and luckily I had a couple of weeks off, and then I kind of just weaned myself out of the splint but I was able to work, and I was
Yeah.
able to get through school and stuff. But like, yeah, it's I don't know if we even want to say that I don't know. There is a risk. It's serious risk, but you can
Yeah,
also walk outside and get hit by a car.
for
You know what I
sure.
mean? Like, and the more you train, the more knowledgeable you are about risks, the more injuries and things like that. And I think that it's just part of it, but it's also it, it it's something you kind of worry about. And I think when I was first working and practicing, I heard it a lot from my parents. Like, you're gonna hurt yourself. Stop doing this. Why are you doing this shit? Why are you doing it? And but I just kept at it. I don't know why. I just kept showing up, and I kept doing it. And I was always aware of injuries, but I just tried to kind of be mindful. Try to make sure if I'm in a bad spot, tap early, whatever. And as a white belt, you don't really do that very much. I've sat in some arm bars, and popped out, and my elbow popped. But, you just do it
Right.
because you're competitive and you want to do well in it. Like physical therapy school is competitive. Getting in is
Right.
hard.
Yeah, yeah, yeah.
It's like cutthroat a little bit. And I think you take that mentality elsewhere.
So you feel like you had this little inner meathead style training that you went after it no matter what, you get it like,
Um,
just a spazzy white belt or just
no, I just
competitive?
didn't. I just didn't. I just felt like as a white belt, I just didn't give up.
Okay.
I just didn't want to give up. I didn't want to give in. Like I don't know, it was something. Whether I did a tournament or whatever, I don't know. Like I feel like I was gritty as a white belt. I don't know if I was spazzy. I probably was. Everybody's spazzy as a
Yeah, yeah,
white
yeah.
belt. But I think I just really did not want to give up. I didn't. So, and I think that it's a slippery slope too. Once you start giving up, it gets easier too. So I didn't want to. I didn't want to even. It
Yeah.
wasn't even part of my thing. I was just trying to work and enjoy it. So
Yeah. I feel like, I heard you and Chu talk about this a couple times before. I think it's all about, like, the culture that you have in the gym.
yeah, absolutely.
So, realizing when you should be fighting and when it's useless and you should start over, that's a
Hmm.
big thing. I think you guys do that really well. I think you guys are really good at kind of like pushing the right mentality
Hmm.
like you said, yeah, you're right. I mean, for 100%, when you're like inside control, like there's that survival time, right? So you're trying to get your underhook in or whatever you can or frame or whatever. And obviously, there's always discomfort when you're inside control. I know really well, but
Yeah.
and then figuring out when that's the discomfort that you're fighting against and it's normal and when you're putting yourself a little bit in harm's way, I think that's a big thing for coaches to push,
Hmm.
and I think you guys do that really well.
Yeah, I think it's but it was stuff like, getting caught in an arm bar and not wanting to tap. I
Yeah,
was like fighting out
right.
of it and stuff when you can do that a number of times. Eventually you can hurt yourself. So
Yeah,
I just think I didn't have the knowledge even of I had the knowledge of the human body, but not the knowledge of jujitsu.
yeah.
And so that it, again, injuries are I think they're more of a risk at white belt than they are as you get more into it. But it just depends because that can be very variable because you have more hours on the mat,
Yeah.
and then injuries kind of happen too. So
So when you're talking to healthcare professionals sometimes or friends or whatever and who do what you do or do something similar, do you try to like convince them to try some jujitsu or are you staying away from that or how do you feel about that?
um, I don't really I don't know. Like I just kind of if they ask me about it, I share about it,
Yeah.
and then I kind of let them lead. So like if they want to know more about it, like why do you do it or what is it like, or I try to just inform them and educate them. I'm not like I'll say come on out, like
Yeah.
just just give it a shot, or but I don't really go like you should come train.
Yeah.
I feel like people find that like if they're curious, there's enough avenues out there to learn and kind of get a little more information, like get on YouTube and find chewy stuff or whatever, and you'll find some information that might intrigue you or might turn you off, right? You're like, why are people doing this? Or
Mm,
man, that looks like an awesome environment, or that
yeah.
seems like these people are really like this person lost all this weight or they won
Right.
this tournament or whatever. So I think there's just it's got to be for your own reason. When you get into jiu-jitsu, it's like your purpose for doing jiu-jitsu is going to probably change because you don't know why you get into it initially. You think maybe you do, but then it kind of changes for you, whether it's to do difficult things, challenge yourself, the community that you're in. It just kind of depends.
Yeah. I'm a little bit different. Like, I have the best training partners and my best friends who are in jiu-jitsu.
Hmm.
Uh, some are PTs, nurses, MDs, and when anytime I talk to anyone from any profession that's in healthcare and they have some interest in jiu-jitsu or they ask me about it, like you said, they
Yeah.
get a little you talk about it and they ask you some questions about it. I always tell them you should try it out
Hmm.
and you should give it a shot. And I always kind of like tier it in that way of I mean, there's people who only do privates, they never spar.
Hmm.
So that's an avenue. Or you can just go to the training and pick certain people you train with and leave it
Hmm.
at that.
Yeah.
Or, I mean, I think sometimes just as simple as somebody going to watch a class is a big success already. Like,
Yeah.
I think what it was like a month ago or so. I have one of my best friends who's a PT, and he's starting over. He did jujitsu or wrestling a long time ago, and then just recently started over again. and I was so proud of him. And then we convinced one of our old classmates who was also in the same clinic to come, and it
Mhm.
was the funniest thing because me and him we were just going at it and a little roll in a spar. And my other friend, the classmate who's never seen anything of that, he's like, "Oh my gosh, that looks so violent."
Yeah,
And like for people on the outside, it looks that way, right? But when you're like in it and you've got experience and you're training with someone you trust, you know that you respect each other's limits, and it looks really violent. But at the end of the day, once you get into those joint like positions or dominant positions, if you've got the right training partner, you're not in a great place because you need to get out,
sure.
but you're not like in a place
Yeah.
of danger.
I think it's definitely intense. I think
Yeah,
there's an intensity level there. Like you feel it when you walk into a gym and people are rolling. There's a lot of intensity in it. And I think that sometimes that's intimidating to some people. And sometimes it's like invigorating to some people, like, oh, this is awesome. I want to do
yeah,
this. But yeah, like if somebody asks me about it, I will talk their head off, but I want them to like lead, right? I
yeah,
don't want to like be the one to like shoving jujitsu
right,
down their
right,
throat kind of thing. And I think it's fun when you get your friends to do it. I think that it adds to for me when I started, it really was me and Adam that knew each other, and then we had some some people, some friends we made, but me and him kind of going together pushed each other.
yeah,
Like, Adam's going to jiu-jitsu, I'm going to go,
yeah,
because it's easy to fall off, right?
right,
It's easy to be like, I'm too tired, or work was crazy, or it's I've got other stuff I need to get done. So it's just one of those things you have to be you have to find. And I think you brought up a great point. Having friends and training partners that you like, that you enjoy being around, I think is part of the appeal to going to jiu-jitsu and being consistent.
hmm. Do you feel like, when it comes to, again, like those outside people looking in, especially in healthcare, do you feel like there's like this negative stigma, especially like from the medical side of things towards jujitsu? Because the reason why I'm asking is, I don't know how it was for you guys or what your experiences were, but when CrossFit really made it big, I mean, a lot of PTs that I knew, and me included for a little while, and I'm still having some issues with it. But we all kind of like bash, oh yeah, well, no wonder they're gonna all get hurt, right? And we made jokes of like, okay, well, we're at the next CrossFit event, we're gonna go and hand out our cards or
Mhm.
whatever, just making jokes like that, right? Not really knowing enough about it. And I feel like that's the same thing with jujitsu, like that negative stigma towards certain sports is pretty prominent. But like you said, earlier, I mean, you can just do about anything and have the risk of getting injured. And there's many other sports. I mean, just soccer, for example,
Mhm.
so risky and could be a high rate of injuries coming from sports like that. But and I guess in the healthcare system, I don't hear that being talked about
Mhm.
as much. But when it comes to combat sports, it's really
It's mainstream. Like,
yeah.
soccer's mainstream,
Yeah, right.
jiu-jitsu's not mainstream. And I think, like, well, and you gotta think about what the goal of jujitsu is. The goal is,
Yeah.
I am gonna make you submit or tap out or give up, whether it's through a submission, through a joint lock or a chokehold. So, that's what people see. They see the purpose of it, right? But they don't really see the other benefits. Not, I mean, you're not trying to hurt anybody, but like the goal of jujitsu is like, I want to win. Like,
Yeah.
me winning means you tap out. That's the ultimate way. You tapping out means I beat you. Points and whatever. That's tournament, and that's fine too. But like, that's the ultimate way, right?
Right.
So I think when people just see that, and then they see injuries, and they see somebody comes in, oh, I injured my knee because of jujitsu. I
Yeah.
did this because of this. So they attribute all these injuries to jujitsu. Um, but you have to look at the layers of jujitsu, and it's like, man, I'm doing something very challenging.
Yeah.
I'm pushing my body. I'm around people that are like minded in a way. Like, we don't have to agree on things, but we both have a strong work ethic. We value doing this thing. We value learning, um, being humble and being humbled. Like, that happens a lot. And like, I think just there's so much. I've said this before, and jujitsu to me is a life skill. The ability to defend yourself is a life skill, and I think the sport and everything that's important. But if you know jujitsu, even if you're in a sport gym or no-gi gym, whatever, and you're like a blue belt, you should be able to handle yourself for the most part against somebody that is of your same size and doesn't have any experience with grappling or jujitsu. You should be able to handle them.
Right.
And I think that for me, my kids, I started them in jujitsu. My son started and he's 6, and my daughter is now 5. And yes, there's risk of them getting injured, but I think it's a life skill, just like swimming is a life skill for them. Those are things that I think are necessary for them to learn. And I think it builds confidence too. And I think there's so many levels besides the injury. Injury is always a
Right.
risk in any sport. It may be more in some and less in others, but the benefits of jujitsu far to me outweigh the negatives. And there are some negatives, right?
Yeah.
There can be, but they far outweigh the negatives.
Yeah, I agree with that. So I mean, I think we can all agree that jujitsu is a long-term kind of commitment if you're wanting to achieve
Mhm.
a certain, adequate level of skill. Um, and I'm struggling. I don't know how you feel about that, but or sometimes I think things are changing quite a bit at the time. But I'm struggling sometimes to convince people that, or jiu-jitsu athletes, to get things taken care of, basically. So,
Mm.
you know, usually I say when something bugs you and it bugs you for 3 to 4 weeks,
Mhm.
and it hasn't gone away, you should
Mhm.
come see me.
Mhm.
And sometimes that's easier to convey than other times. And I think the problem with it is that, like you said, the end goal of jujitsu is to submit someone. That means that there's going to be pain involved for that
It's possible.
reason, right?
Yeah, it's possible.
So I think the hard part is getting away from the concept of jujitsu is pain to jujitsu can have or give you pain, whereas chronic pain is super different, and
Yeah.
chronic pain should always be taking into consideration to be addressed as soon as possible. Whereas getting a tweak from, like you said, maybe an armbar, you tweaked your elbow,
Mhm.
and that goes away in a week.
Yeah.
Well, that's different, right?
Mhm.
Then, oh, every time I'm trying to pass this person's guard, my back is giving me a really sharp pain
Yeah, yeah.
and stuff like that. So, how do you manage
That's
that?
the $1,000,000 question.
Yeah, that's the tough one.
That's the thing because, I think people attribute discomfort with jujitsu sometimes, and I think they feel like, "Oh, I probably should have some pain or some discomfort." Maybe, but like you said, it's the lingering things, the chronic things, and just you develop some issues, some imbalances, some overuse issues. If you play a certain type of guard or a certain type of position, you go on underhooks all the
Yeah,
time. You may develop some shoulder issues. Just a lot of it's like people think the train jujitsu, they fall in love with jujitsu so much that that's all they want to do. And what I try to do is I don't really lead with the pain part, but like I'm more like the way I have people buy into jujitsu is like this, what I do will help you perform on the mats, be healthier on the mats, improve your longevity. So overall, you're not gonna if we address something early on and doesn't turn to be a chronic thing, well, then it's going to be easier to treat. Number one, it's going to be easier
yeah,
because, and
for
then
sure.
we're like, now we've got this pain pattern or what have you. We have these issues we're dealing with, and it's going to take, you're going to perform or you're going to train at a lower level because you're not going to be able to push yourself as hard versus we take care of it now earlier on. We spend a little bit of time or a shorter amount of time taking care of it, and then you can go train at a higher level.
Right.
It's hard to, because we're a little jiu-jitsu athletes are a little crazy, I think. I,
Yeah,
I think we're all a little unique in a way that we want to do this thing. We go instead of sitting on the couch and watching TV, doing something comfortable, we go and we get in this room and we sweat and we bleed and sometimes we hurt a little bit. And we push ourselves to exhaustion. Um, I think people that do jujitsu love jujitsu, and that's all they want to do. And what I try to educate them is like, this is an adjunct. This is kind of a support to your jujitsu. This
yeah,
is going to help your jujitsu long term. It's going to
it
keep you on the
does.
mats. Um, and so some of that's through education, through Q&As, through podcasts like this, through me making videos. That's the whole goal of that. I started that because people kept asking me questions like, what are some recurrent questions I have? So I did the YouTube channel because I was like, maybe I can help people. And they'll find this thing and they'll be like, oh, that helped. Or that was useful. Or I'm not trying to treat anybody online. What
Yeah,
I am trying to do is just educate.
right.
If I can at least like, oh, you see an exercise, like, oh man, that kind of feels like it's good. So maybe they can just get the ball rolling, thinking about their body and maintenance on their
Yeah,
body. I think that's important.
yeah. I think that's more and more changing. I don't know if it's because of social media, or just the access. I think that's a big part. But I think like jiu-jitsu athletes in general are kind of like steering away from the nonstop full hardcore training, full hardcore roles, and they're being a little bit more precise in their training regimen, and like you said, they're looking stuff up to supplement their movements
Yeah.
and exercises. So I think that's awesome. I think
Yeah.
I mean, there's a lot of bad stuff online too. So it's always nice to maybe have someone that you can run things by. But I think trying to research things on your own to work on some things that
Yeah.
you're having issues with is important.
So here's a question for you.
Yeah, yeah.
Like for me being doing jujitsu for a while, I have a pretty decent knowledge of that's a BS technique or not. Do you
Okay.
have some advice for somebody looking at maybe a rehab or like some kind of social media post, like to think about, oh, that looks like, is there like a litmus test or something you look for when you're looking through social media to say that's a BS technique?
Yeah, so that's a great question. I'll scroll through some social media apps. I mean, for a little while, I'll
Yeah.
usually do that specifically and just look at certain like accounts that I've tagged because they sometimes put out good exercises or movements.
Yeah.
And then it's like hit and miss. So what I look for is just movement and where kind of like the points of contact are, whether that be on the ground or some people use exercises against walls, for example.
Hmm.
So I always look at the movement and look at each specific joint. And I guess the reason why I do that is because I've just finished my fellowship, manual and orthopedic fellowship. So that's all we did, like
Hmm.
3.5 years straight. Look at movement, look at where stress points arise, look at joint stresses that are increasing and
Hmm.
where the movement is being hung up.
Yeah.
And for that, you have to kind of like know what the movement should be looking like.
Yeah.
And so, what I look for, like in those videos on those apps, is most of the time either stress points in the back, in the
Yeah.
shoulders, or in the knees. The knees are a big one. So,
Mhm.
there's like, for example, you put a great video out about the 90-90 position
Mhm.
and working on hip external and internal rotation and the kind of like a windshield wiper
Mhm.
motion.
Yeah.
But here's the thing. So some people do that in standing and they do that with their feet slightly turned out. So now they have this internal rotation at their femur while their tibia is externally rotated and their foot is planted on the ground and they
Mhm.
try to get their knee to the ground. Now, some people can get away with it, but a lot of people create a lot of stress on that inside of the knee. And
Mhm.
so stuff like that, I look at and I like
So, like,
don't like as much.
yeah, like what I was gonna ask you, if you're someone that doesn't know, if you're someone that doesn't
Ah,
know a lot about physical therapy, right? Like that's what I was kind of, and that's great. Those are good
yeah,
points. If you're a PT and you're listening to
right,
this, like you understand like the mechanics and things like that, the joint mechanics and how
right.
everything needs to work. If you're stressing the knee, if you're messing with the positional, integrity, you're putting the knee in a compromised position. You don't want to be working in and out of
Yeah,
that position. Again, you can to some extent. It's good to
right,
train some of these awkward movements
right.
in a controlled environment, but it's not really a repetitive thing you want to do over and over. But like what I was asking you, and this is, if somebody sees like an exercise online, they don't know anything. They're a jujitsu guy or a jujitsu girl, and they don't
Yeah,
know anything,
yeah.
and they're like, "What is this any good? Should I do
Oh, yeah.
this? Like, is there anything you look for?"
Um, I would just if I were someone who didn't have that background, I would say if you're doing a movement and you're having pain with that movement repetitively or
Mhm.
like a discomfort with that movement, like on like let's say you're doing a set of 10 on that movement and you
Sure.
have discomfort maybe for 1 or 2 reps, I wouldn't be too worried
Hmm.
about that. But if you're having discomfort like with just about every rep that you're doing or more than half of those reps, I think it's not a good exercise for you to do, just because you're probably lacking some mobility somewhere where
Sure.
that person in that video has that mobility that you don't, and you're just creating a stress point. So I would just go by comfort level, by ease of movement too.
Hmm.
Like if you, I never recommend people, be very forceful in when they're stretching or trying to improve their
Sure.
end range of motion, just because of that muscle guarding that takes place.
Hmm.
So they're kind of like fighting themselves. So anything that is fluid in motion and doesn't create you a whole bunch of discomfort or pressure in in a joint, I
Hmm.
think is a good
Yeah.
exercise
Yeah.
to try and move through.
Sure. Yeah. Movement. Yeah. Like pain. That's a great point. Like just not having pain with the movement is important, and that could even be like, well, why am I having pain here? Let's just start the questioning
Yeah,
process and like try to figure it out. Or like, I have pain with this movement. Why is that happening? And that might be, oh, I know Patrick at the gym.
yeah,
He might be able to help me out, or Eugene or whoever, right? Like I know I may need to. Some people will ignore it, and some
yeah,
people that are like very and I think in jujitsu, we are very aware of our bodies. I think it might be like, oh, why does it hurt? or what's the deal with that? So that's a great point. Like if you have pain with a movement, it's probably not a good movement for you. It doesn't mean it's a bad exercise.
Right.
It just may not be the right movement for you or your body type or what your physical condition is in.
Yeah, exactly.
Yeah.
That's a great point you put up with PTs in the gym, and I'd love to hear your kind of take on this. Um, I don't know about you, but when I first started my jujitsu specialty, basically treating jujitsu athletes, I did that because people in the gym came up to me and were asking me questions, and
Hmm.
they were so excited about me being a PT training with them.
Yeah.
Like, I have gotten so much, like, confidence and gratitude also from the people I train with at the gym I'm going to, and even other gyms when I'm visiting, and they're always excited about a PT coming in. They're always, like, all in on, listening to suggestions if they ask me questions, and they're really diligent, and they're really passionate about
Hmm.
getting better. And I'm not sure if you got that experience. I'm sure you did too, but I think that's awesome, and that's something that drives me, which is why I'm doing this content with
Hmm.
you,
Hmm.
because I want to give back. I mean, that feeling is so phenomenal, and it drives me for weeks on end. Just one person, and so I want to be able to maybe give some of that back and help people stay on the mat, stay healthier, and be good training partners.
Hmm. Yeah, I think one important thing why people are grateful for you is probably because one of the reasons would be that they trust you, and they trust you because you're in the jiu-jitsu community.
Yeah,
If you're someone that comes out and you're out of left field, you don't have any idea or any concept of jiu-jitsu, and you set up a table and you're like, hey guys, I'm just doing injury screens. But you don't have any knowledge of what they do,
right,
what the mechanics are in their bodies, what the requirements are for jujitsu. Because I've done this. I've had therapists, call me and reach out to me, and I try to talk them through.
right.
And some of them have no idea what the physical requirements are, what the mobility requirements are for jujitsu or position.
Yep.
Like, like a half guard or just anything, just any kind of basic, but they don't know. So how can they can maybe treat your minor injuries, but how can they really safely get you back to returning to sport? I don't think they possibly can, but not as well as someone that's in the actual like trenches, like is
Yeah,
training, that's doing the work. Like I've spent as much time doing jujitsu as I have being a physical therapist. Like I've been injured, I've been there, I've been in the positions, I've been tired, I've
yeah,
been in pain, and I've gone through that stuff. So I think people trust me, and they probably trust you because first of all, you know what the hell you're talking about. And number two is you've done it and you do it and you speak their language. That's powerful.
yeah. It's like with any specialization, right? So with movement based things, PTs are really, really good at finding deficits.
Hmm.
But the specialization, that's the next level. Like, for example, when I treat baseball athletes, like, I have no problem treating baseball athletes. Like, it's a very similar, like, movement pattern that they need to be able from one baseball player to the next, and it's, the throw mechanics and stuff like that. We get that taught in school. So, but if there's someone in my clinic or somebody I know that's specializing in baseball athletes, once I've done as much as I can, that's probably where I'm going to
Hmm.
send him, or just to
Sure.
have him get checked out,
Yeah.
or again, like you said, I'll reach out to that therapist and see if I'm missing something.
Or a specialist. Yeah.
Yeah,
Somebody that really kind of knows. And there's not like a specialist for, and I'll reach out to people in our field, like in physical therapy, but maybe they're like athletic trainers. Like there's a guy, Dr. Christworth, who's actually he is an athletic trainer, but he's got like I think he's a PhD, and
okay,
he's worked IBJJF tournaments. Like he's done a lot of like immediate kind of like acute care stuff, dislocation stuff
yeah,
like that, which some of us get some experience in, some of us don't. For me, that's something that I've seen and I've learned more through being on the mats and taking care of people, but that's something I want more of.
yeah,
And that's something, I've reached out to him about certain things, and
right,
getting more. I think you got to know what you know and know what you don't know. And I don't know everything. Like,
yeah,
I may post some videos and I think they're good and they're good content, and I think this is gonna do awesome, and it doesn't. It's just
yeah,
sometimes also what we do isn't terribly sexy. People don't reach out and look. They're not just if they're into jujitsu, they're gonna be looking up, oh, this crazy armbar or this crazy submission or whatever, inverting or this leg lock or ankle lock. They're not really like, well, how do I keep myself from getting injured? They usually seek us out based on necessity. usually
Yeah.
after an injury. So if we can
Yeah.
like put that idea in their head that they kind of can, like you should be planning ahead. Like you should be kind of, all right, I'm gonna do body maintenance stuff. I'm gonna do mobility work or strength training or whatever to keep my body together. I'm not just gonna do jujitsu twice a day, 6 days a week or 7 days a week, because that's a great way to break your body down. It's
Yeah.
anything you're doing repetitively like that is just it's gonna break you down. And I think we're trying to increase the longevity of jiu-jitsu because jiu-jitsu is so unique to the fact that you can do it at some capacity, even to a very old age. In some capacity, you may not be able to roll with the 20-year-old, but you could still move around and do some positional training and some sparring. So it's unique in that way that there's a lot of applicability through different, from a 5-year-old to a 90-year-old. I mean, to some extent, you can do
Yeah.
it jiu-jitsu.
Yeah. That's a really interesting point you put up about managing injuries in the gym while they happen.
Hmm.
And it's really special when, as a therapist, because it's usually not our realm, right? So I don't know how you feel about it, but personally, I feel like whenever an injury happens, that's where I'm the least useful. And that's because what I'm providing is like first aid. So I'm like managing the initial injury. But don't get me wrong, that's a huge deal, right? But I'm just saying, like, as a therapist, I feel like the most useful as something is happening. Like as you're moving and you're not moving well and you're getting pain in that
So
moment. That's
before maybe they get the injury.
yeah, kind of like in a subacute
Yeah,
phase. Like
yeah.
chronic, I mean, of course, but it's going to take a little while longer. In acute, I feel like, well, yes, we're of course, managing the injury, but I can provide first aid, and then it's kind of like rest
Mhm.
and ice,
So, what
etc.
you do in that instance, what I do in that instance, if I educate, that's the main thing, like,
Yeah,
we
that's a
had a
good point.
kid that, like, rolled on his shoulder, and, like, I was on the other side, he was in kids' class, he was, like, did, like, a forward roll and, like, landed on his shoulder, and I was like, "Alright." And I couldn't get his gi off. Like he was in a lot of pain. He was like probably 7 or 8. And I was like, all right, let me see if I can have you lay down, do this, do that. And like I was trying to move his arm just to see if like anything was dislocated. It's kind of
Right.
hard, you can't
Yeah.
really, he wouldn't let me really touch his. And I was like, where's it hurt? And he's kind of holding his arm like this. And he's like, right here, his collarbone. I was like, all right, so this is what I want you to do. Like, I want you guys, I think, and I says, I was like, it's possible it could be nothing. It could be this, could be that. But, you educate because some people will just go home. If it's an adult, like, I'm just hurting really bad, I'll be fine. But if you can
Yeah.
educate them, especially parents or kids or whatever, you err on the side of caution with kids. I mean,
Yeah.
really with everyone I do. But like, I'm like, all right, so it's possible it could be this, it could be that. My recommendation is this. And I don't have any qualms with like, you might need to go to the ER. And if they go to the ER and they're like, man, there's nothing wrong with me. Well, that's the best case scenario,
Exactly.
right? The worst case scenario is you don't go and there's something majorly wrong and you don't get it treated in time and then it turns into something else or something worse.
Yeah.
Best case scenario is you go to the ER if if you're not sure. And obviously we're looking for fractures or anything like
Yeah.
that. And everything's okay. Great. Well, you went, you're okay. It's just a sprain or this or that. And let's figure out a way to get you back on the mats. Right. So, but yeah, there's you think about the mechanism of injury, how it happens, what their symptoms are, how they're reporting and things like that. So I think we can be useful. I think definitely myself and I think that like we can be more educated in that realm, and I think that's somewhere I feel like I want to be more educated because I
Yeah.
see that a lot, and I want to be that first line of help because usually that's what happens. I'm forced in that role
Yeah.
because we have like a couple people that are maybe like are working on becoming doctors, but they're not yet, and maybe some I don't know if we have some nurses or not, but I'm usually the one.
Yeah.
So I'm there anyways, whether I want to be or not, and
Yeah.
I want to try to give them the best advice I possibly can.
Yeah, uh, I agree. I think education is huge in that moment, and
Hmm.
like for me, the worst part is if somebody comes to me thinking that they may have an injury,
Hmm.
and they have the injury.
Yeah.
That's the worst like feeling for me. But I try to go through the educational part and just kind of a
Yeah.
lot of times it's about also managing anxiety because jujitsu for a lot of people who really get into it is super important. It's a lifestyle.
Mhm.
So for me, that's the hardest part is identifying an injury that
Mm.
thought was there and it is, and then just kind of I try to help the situation, like you said, with the educational
Yeah,
component, and
absolutely.
then also laying out, hey, this is not the end. This is the few steps that you have to
Mhm.
look. towards 2, and it'll be okay. That's basically
Sure.
the way I kind of, I guess, try to make the situation better.
Sure. Yeah. Yeah.
Yeah,
I agree. Like, I just think you have to kind of, you gotta know what you don't know.
yeah,
And sometimes you'll be wrong.
yeah,
Sometimes I'm wrong, and that's okay.
right,
Like, you do your best and you try to give them the best advice you possibly can. And we learned it in physical therapy school is do no harm.
yeah,
That's the thing.
yeah,
Like, we're trying to like protect them and give them the best advice possible.
yeah,
And we're human,
yeah,
stuff happens. But yeah, you just try to give them the best advice possible and um, be there like as a support system or someone like maybe after they've had an injury or whatever. And that just someone they can bounce ideas off of as well.
yeah.
Um, that's the way I kind of go about it.
That reminds me of a story because we are right now in the weekend of the second camp that Chewy is putting out,
Hmm.
and I was at Chewy's camp last year, so I'm privileged enough to be here again. And the last year is so interesting because the first night of us training, and it was nogi, within like 40 minutes or so, somebody got injured. And then Chewy pulls me aside and asked me to check him out. And we just talked about this. Like the assessment part is like challenging because, like you said, you either have a gi on,
Hmm.
and then you try to palpate whatever,
Yeah.
you do your special tests and stuff like that, and you do the best you can, right?
Hmm.
And then the first aid comes in, and that is something I think is super valuable, which is again why I'm trying to get healthcare professionals more into the sport, because they are present in other sports, right? So, like you
Hmm.
said, you've got your
Yeah.
athletic trainers and stuff like that. So, I feel like the jiu-jitsu community is a little bit left behind on that, but hopefully not for much longer. So,
Yeah.
that's why I'm trying to push healthcare professionals to at least get more educated into it too,
Hmm.
and be more available, perhaps.
Yeah, and if they're more present at these events or the training, they're going to gain some knowledge. I mean, they're going to at least get the purpose, right? Well,
Yeah.
soccer, the purpose is to score a goal.
Right.
Well, they understand. They'll maybe get some knowledge of the positions and like the purpose of a movement or a position, like where you're trying to accomplish, essentially.
Yeah. For sure.
Yeah.
For there might be some PTs who might be watching this. For the PTs that are watching, and they might, if they're training, kudos to you. That's great. If they are in the gym, because this is one question I may have asked you in the past, or I had at least at one point. Um, how do you manage having your role as a PT in the gym and in that community? Because you have to, sometimes you have people come up and they'll ask you like a quick question at the end of class, and you're like maybe 5 to 10 minutes away from having to leave. And like, how do you best address like, or how is your process, I guess, about asking them, understanding what their problem is, what their question is, and trying to guide them to either seeing you, seeing the right exercise, or what next step they should take? How do
Hmm.
you do that? Let's say, for example, at the end of the gym, at
Hmm.
the end of the session, when you have a limited amount of
Yeah, so
time,
that's tough because
right?
you don't want to cut anybody off, and I'm more than happy to stick around and talk to people if I have the time. But people they trust you, so they feel like they can approach you, which is what I welcome. I want them
Yeah,
to, but
for
I'm like
sure.
sometimes I'm like, all right, so I'm trying to give maybe some kind of advice for the as best as I can. Depends on the situation, but honestly, like all right, let's set up a call or call me or text me. And let's set up a
That's
time just
good.
to give me more information. Like let's spend a little more time talking. I may try to take them through a couple movements, like man, my hip hurts here or my shoulder hurts here.
Yeah.
I may quickly, like you said, do some special tests and take them through some range of motion that would not take very long at all. Just get a little bit of information and then I can get some more background information, like if I have them call me or I'll say, let's set up a time to chat. And the thing is like when I treat at my office, I'm basically like, I try to see people. This is probably bad for my business practice, but I try to see people as few times as possible.
Yeah.
Traditionally, like for physical therapy, people come in 45 minutes or 30 minutes. They're coming 2, 3 days a week for 6 weeks. I'm like, I'll see you once a week, probably for a couple of weeks, and I'll probably back you off to once every other week or even longer. I just do that because I know people when they come see me, they're motivated. That's a difference there. When
Hmm.
people are told to see me versus when people seek me
Right.
out, that motivation, that interest is huge because they're spending their time and their money. Um, and I think that if I tell them I need to see you for a session, I think they're mostly okay. But I usually don't say if I can give them a couple things. I'll try to do that, but again, within reason. Like if I feel like pretty confident, if I feel like it's something more serious, then I probably will, on the see in the office, or maybe go get some other testing at your physician, or maybe get some, x-rays or whatever, and I'm not a big pusher of x-rays, but like sometimes you want to make sure you want to clear for any fractures or anything like
Right.
that. You don't want to, impede the healing process, and that's important too.
Yeah.
And some things we can check and some things we can't.
Yeah. I think one of the last things we should probably talk about is the difference in PT, in the field of PT, or physical therapy, just because a lot of people that I talked to had already physical therapy for an issue, and it was just not good physical therapy. So
Yeah.
if you guys are listening and you had that experience, just know that there's bad apples in every profession.
Hmm.
And I think overall, also, we have to say that physical therapy has come bounds forward in the last 10 years or so. So if you've had physical therapy and you had a bad experience where, let's say, I mean, I don't want to step on anybody's toes, but let's say they just had you in a corner doing exercises on a list that you were just, unsupervised perhaps, or supervised, but it wasn't very good supervision. Just know that there's good physical therapists out there. You just have to like look around in your area, and I encourage you to do that rather than giving up on physical therapy altogether, just
Hmm.
because you're gonna not address the underlying issues of your problems, and you'll perhaps not be able to train for as long as you would like to.
Hmm.
So I think
Yeah.
that's an important thing to at least mention.
Yeah, I agree. And I think that if you go to somebody, and the last thing I try to do is take away somebody's ability to train and tell them,
Right.
like, all right, we got to shut it down. We can't. It's the last thing I want to do. So I'll try to work with someone as much as possible. And if you go in, and it's funny, like some of these doctors, Chewy talks about the story where he broke his nose pretty badly,
Oh yeah.
and he went back to the doctor, and they were pulling the gauze out of his nose, and they're like, "Oh, so you're gonna keep doing this thing?" He's like, "No, yeah, I'm gonna do this. This is what I do." It's like,
Yeah.
so somebody asks me, like, and I'm not gonna tell somebody not to train. I understand what it means for them to train. I understand like kind of how important it is for them to be on the mats in some capacity. So I think one sign of not a good physical therapist, if somebody tells you just to stop doing that thing. Now, again, if it's life threatening, like, you've had this major head trauma or something, and if you, by any chance, being choked or anything like that, getting hit in the head is like could kill you, like, yeah, you probably should at least modify to a very extreme extent your training. But again, I'm very cautious on return to therapy. I'm very mindful of that, but I will also try to keep somebody on the mats training, as safely as possible, and that's relative to the person, to the gym, to their skill level. But yeah, nobody should. If they tell you you should quit jujitsu, I think that's probably a sign that they're like, oh, it's probably not the best therapist.
Well,
Or yeah,
they're just maybe not educated in it, and
correct,
have
correct,
certain
in that
stigmas again,
capacity.
like we
Yeah.
talked about earlier. Yeah.
Sure. But also, like, if you're a jujitsu practitioner or grappler, if you're doing physical therapy, you're not doing some type of return to sport or have a game plan. Um, that's also something you should look at, because a lot of therapists can get you. You have a rotator cuff injury, they can do the basics with you and get you to a certain extent. Now, the disconnect that I see, and what you and I do, is there's a gap between return to sport. So I'm done with physical therapy. I'm good to do my daily job or my daily life,
Yeah.
versus I'm good to go back to training. There's a lot of issues there, that there's actually a bigger gap than I think people realize. And that where people can get in trouble. The number one predictor of injury is previous
Yeah.
injury,
Yeah.
right? So if you've injured something in the past, you're more susceptible, not as a general rule. Like, I don't want to speak in absolutes on anything, but yeah,
Yeah.
you should be mindful. And so figure out ways to train, integrating training back into your life and onto your body in a way that's kind of controlled and as safe as possible. There's no guarantees, right?
Yeah.
So
Do you think PTs are a little bit more prone to maybe getting more injured, or having a bad training concept or regimen? And I'm asking this because most PTs are just tremendously bad patients, because
can be.
I mean, yeah, just in general, I'm just
Mhm. I can be.
generalizing. Yeah. Just because we might have certain ideas of how we can fix whatever happened. Like, I've tweaked my elbow. I know what to do. So I'm doing that. And then
Mhm.
I'm going back. So,
Yeah, but I
anyway,
think that gives you a unique advantage. Like, I've trained with injuries, and I know, okay, I can
good
train.
point.
I can train. I know I sometimes will maybe be a little more risky than I would tell my patients to be, and the reason why is because I feel like I have a better understanding of the mechanics of my body and kind of what I can and can't do. And
Yeah.
sometimes it's hard to explain that to someone or get them to buy in exactly to what certain movements. Oh, well, it's my bicep. So, I'm just not going to bend my arm, but I can grip. Well, wait, you're using some of
Yeah.
those same
Yeah,
muscles,
right.
right? If you're supinating, you're
Yeah,
pulling,
yeah, yeah.
you're working your bicep. Like,
Yeah.
so, just things like that. Like, I just know certain things I can and can't do. I've trained with one arm before frequently. I fractured my radius, fractured my arm. I let it heal to an extent, and I didn't use it. I just tucked it in my belt and I trained one arm and I was able to do that. There's certain things I couldn't do, certain things I could do, certain sides I could train from and couldn't. But I'm not saying I recommend that for
Right,
anyone to
right, of
do. But
course.
like you said, we're not the best patients.
Yeah.
I wasn't the best patient in that instance. So
Well, I mean, it's also like, what are you trying to accomplish in the training session, and who you're training with.
sure, sure.
So
Yeah. I mean, nobody's gonna like pull my arm out and try to attack it. And
trying to
those
take that cast up.
um yeah, it's just one of those things, man, where we can be, but I think it's because we have a knowledge that exceeds like of the body that kind of exceeds the regular person. That's not the thing that they've spent their, a lot majority of their life studying.
Yeah.
So I think that helps us. But then being a jujitsu practitioner maximizes that even more. It allows us to kind of understand what the capacity, what's needed for the body.
Yeah. Do you feel like I don't know how you feel. I'm kind of like, I guess compared to you especially, I am new at this jujitsu thing. Almighty
How long you
blue
been training?
4 years. Almighty blue belt, one stripe. Okay.
It's good. You're a white belt when
I was
you're a
last year.
white
Yeah,
belt,
yeah.
so that's good.
Anyway, so how do you feel about this? Because I feel like, well, I have to deal with my expectations and put them in order, because I'm trying to do tournaments, and I want to do really well, and I want to be the best in the gym at my weight class, at my rank, etc. But then I have to remind myself, well, how much time am I putting into the gym? How much training am I doing? And then I have to be realistic with that concept of, well, I'm not putting enough time in to be able to accomplish these goals. So I don't need to expect myself to do that and force myself to do that unless I can put the training behind it. So how do you feel? Because you're really busy, you're a working PT, you've got the podcast, you got all these things going on, and you compete too, right? I don't
It's
know
been
if
a
you're
few
still,
years, yeah.
but you have. And how do you manage your expectations, or what's your process of dialing yourself in to get to the right balance?
I'm almost 39 years old.
You're doing great.
I'm a jujitsu hobbyist.
Okay.
I train about 3 days a week. I have to compare myself to people in the same. I can't compare myself to the 20-year-old blue belt that's on the mats every single day. That's a wrestler.
Shout out
That's
Brendan.
there's Brandon, who's a beast. And let me tell you, I can't. I have to, and that's hard to do because when you get into this, you don't get into it because you want to be okay.
Yeah.
But when you get older, you realize there's levels. There's levels to jujitsu. There's levels to black belts, to every belt. I mean, you look at some of these gyms, even Chewy will tell you. Chewy's a very, very good grappler.
Yeah,
He's
he's
very,
awesome.
very good. But here's the thing: there's levels. There's guys that have Chewy's number. There's guys that
Yeah.
have, Gordon Ryan. He's kind of the exception to the rule right now. But eventually something with him. It's just everybody is. It's just jujitsu's exploded. The information has exploded. Like anybody can get good, can get good at jujitsu. Most people can't, but like you have to keep it. What are your goals? What are my goals for jujitsu now? Are my goals to be a world champion? Probably not. That's probably out of the cards for me. I have to be realistic with myself. I started when I was 25 years old, probably something like that. So I was already like in my physical prime, but my jujitsu knowledge was very, very minimal, so I have to like understand that, yeah, if I go against someone of similar age, of similar, time on the mats, experience level, I'll probably do decent. I'll do well. I'll hold my own. And that's who I have to compare myself to, if I want to even compare that.
Yeah.
But why am I doing jujitsu now? Like, what's my purpose? To challenge myself, to push myself, continue to get myself out of my comfort zone, to learn new techniques, which I love doing. I think it's what your expectations are and what your goals are and what's your purpose for training at this point. For me, it's like, man, I, I'm I'm able to train pretty hard. I don't get to train as much as I want, but I'm able to get out there and train consistently. And my body still feels pretty good, and I'm going to push it. I'm going to do the best I can, but I have to keep it within the guidelines or the ratio of like who's at my same skill level, my same life situation, that kind of stuff. So I think I think it'd be hard, especially at black belt. I mean, you kind of already been through a lot of that stuff. You've learned some of those lessons, but you're still learning, because people come after you. You're a black belt. Let's see if I can tap this black belt. You get that. You
Mhm.
get that. And that's okay. That's you have to expect that. And I think at that point, I'm not really I've put enough time on the mats. I'm not really trying to prove myself to anyone. Um, maybe to myself a little bit, but it's something you're always going to battle with because some people just there's always someone better.
There's always somebody better than you.
There is,
Always.
yeah, and it's hard. It's hard to accept that, but sometimes you gotta realize why you do jujitsu.
Yeah, that's the beautiful thing about jujitsu. It's just you're great, and then sometimes you're not, and you have
Yeah,
to figure out.
you're humbled,
Yeah,
and sometimes
exactly.
you're the
Figure
nail,
it
and
out.
sometimes you're the hammer, and sometimes you feel great, and sometimes you feel like shit, and that's okay. You still trained,
Yeah,
and I have rarely left jujitsu feeling that, man, I wish I didn't go to jujitsu. So every time after training, you feel good. You feel like you accomplished something. So I think that's important. I think keep your goals in perspective and like compare yourself to Patrick to 2.0, whoever he is, same size, same age, same time on the you have a career and you're juggling a full-time job and other things and building things, and I think it's like there's not time for everything.
right.
And it's just how much, when I was younger, I could put more time in. I have 2 kids now, I have to I have to try to balance my life in so many different ways. So I think I'm okay with where I'm at. And maybe things will get a little less busy or whatever, and I'll be able to train more. But I want to be in the capacity where when I am a little older, if I have more time to train, then man, I can put some gas on the pedal and get after it and not feel like I'm too beat up. So there's other things I can do. And then we
Yeah,
can talk about that too. If you can't get on the mats, there's a lot of things you can do outside of jujitsu
yeah.
to support and supplement your jujitsu. And I think that's something uh, with physical therapy and with other things that people don't realize that you can do things outside of jujitsu to supplement, make your jujitsu better.
I agree.
Yeah.
All right, I think that does it.
Wrapping it up.
Yes, sir.
All right, dude. Thanks for having me on.
Thanks, Dr. Eugene, the Jiu-Jitsu Therapist.
Thank
Guys,
you
if
guys.
you have a chance to check out his channel, he has great stuff on there. And I was your host, or tried to be, on the first
That's
podcast
right.
of Expat Physical Therapy, and I'm Dr. Patrick. Thanks for tuning in and listening, and I hope you get something valuable out of it. All right, guys.